heart's a more complex organ. It doesn't only have vessels. So what we all hear about is heart attacks. You know, someone has a heart attack, that's a big thing, that's heart disease. So a heart attack is when you block off a vessel supplying blood to the heart muscle and the heart muscle starts dying. That gives you that severe crushing chest pain. It goes up to your neck, it goes down your arm sometimes, goes to your back, you get sweaty, you get nauseous, and your heart is under threat. For something like a heart attack, you need to get to hospital quickly. The sooner you get to hospital, the better, because we can get in there. There's medication to open the arteries. There's what we normally use, do an angiogram, and we blow up balloons and we break up the clot and we re-establish flow into these vessels, and sometimes you put something called stents in to open up arteries. However, there are other things that affect the heart as well. For example, the heart has a complex electrical system. So you may have abnormalities of the heartbeat. People have palpitations. You may have very fast heartbeats or very slow heartbeats. If you have very fast heartbeats, you need to come and see us. We need an ECG, and then we can do various things, either medication or there are various ablation techniques or burning inside the heart, as we say, to actually stop that. You may have very slow heartbeats, in which case you must have heard of people having a pacemaker put in, something to actually help the heartbeat. And then, of course, if that's the structure of the heart that we're looking at and the vessel is on the surface, inside the heart we have something called valves. That controls the flow of blood. So the blood flows in a particular direction as the heart pumps and doesn't go backwards. We have valvular heart disease. You could have rheumatic heart disease as a child. You had a bit of sore throat, a bit of infection in your throat that affected your heart valves. And as you get older in life, those valves start failing on you. Or you could get an infection on the valves, not common, but that can also happen. And then you have a destruction of the heart valves, in which case you may need valves to be replaced with valve surgery. So the heart doesn't just have, it's not just a heart attack, which is the big news and the big headlines. There are multiple other issues affecting the heart as well. The one other thing we often hear about is heart failure. You have people who are short of breath, can't walk, tired, their legs are very swollen, they end up with water in the lungs. We're seeing a lot of this with either after heart attacks or even after things like COVID-19, with heart failure, the heart muscle being affected by myocarditis and getting weaker and stuff, causing heart failure. So there's multiple issues in the heart.